A subcutaneous injection is administered into the subcutaneous layers of the body. The subcutaneous layer consists of adipose, or fat tissue, and is located just under the skin. Subcutaneous tissue is located all over the body. However, certain sites are more commonly used because they are located where bones and blood vessels are not near the surface of the skin. These sites include the upper arm, thigh, back, and abdomen. The medical assistant is often responsible for administering subcutaneous injections. One of the most common injections administered subcutaneously in the medical office is an allergy injection. The medical assistant will show you how to administer an allergy injection to a patient who is allergic to mixed pollens. Before proceeding, sanitize your hands. Next, prepare the injection. To prepare an allergy injection, you will need the patient's allergy medication, a syringe with small calibrations known as a tuberculin syringe, a needle with a gauge falling between 23 and 25 and a length between 1/2 inch and 5/8 of an inch, and an antiseptic wipe. The patient must receive 0.35 cc's of her mixed pollens allergy medication today. Draw up the medication and place the needle and syringe on a tray along with an antiseptic wipe, a gauze pad, and an adhesive bandage. Greet the patient and introduce yourself.
Hi, I'm Diana.
Hello.
Identify the patient by full name and date of birth. Explain the procedure and purpose of the injection.
So you're in for an allergy injection today, right? Yeah. Okay. And you've been getting these about 2-3 months now?
Yeah.
Select an appropriate subcutaneous injection site. Carmen's last allergy injection was administered into her left upper arm, so this injection must be administered into her right upper arm. Make sure the entire area is well exposed to ensure a safe and comfortable injection. Cleanse the site with an antiseptic wipe using a circular motion. Start at the injection site and move outward. Do not touch the site after cleansing it, otherwise you will need to repeat the cleansing process. Allow the area to dry completely, otherwise the wet antiseptic may enter the tissues when the skin is pierced, resulting in irritation and patient discomfort. Apply gloves to protect yourself from blood-borne pathogens. Remove the needle guard. Position your non-dominant hand on the area surrounding the injection site. Grasp and hold the skin in a cushion fashion for a thin patient such as Carmen. This ensures that the subcutaneous tissue and not muscle tissue is entered. The skin may be held taut when administering an injection into a normal-sized adult. Hold the barrel of the syringe between your thumb and index finger. If you are using a 5/8 inch needle, position the needle at a 45-degree angle to the arm. If you are using a 1/2 inch needle, position the needle at a 90-degree angle to the arm. Insert the needle quickly and smoothly to the hub. Remove your hand from the skin. Medication injected into compressed tissue causes pressure against nerve fibers, which makes it uncomfortable for the patient. Hold the syringe steady and pull back gently on the plunger to determine whether the needle is in a blood vessel. If this is the case, blood would appear in the syringe. If blood appears, withdraw the needle, prepare a new injection, and begin again. Inject the medication slowly and steadily by depressing the plunger. Avoid rapid injection, as this can create pressure which destroys tissue and leads to patient discomfort. Place a gauze pad over the injection site and quickly remove the needle, keeping it at the same angle as was used for insertion. This minimizes patient discomfort. Apply gentle pressure to the injection site with the gauze pad to help distribute the medication so that it is completely absorbed. Avoid vigorous rubbing, which could damage underlying tissue. Activate the safety shield on the needle. Properly dispose of the needle and syringe in a biohazard sharps container. Remove your gloves and sanitize your hands. Chart the procedure. Include the date and time, the name of the medication, the dosage given, the route of administration, and the injection site used. Stay with the patient for several minutes to make sure she is not experiencing any unusual reactions. Tell the patient she must wait at the office for 15 minutes to make sure that an allergic reaction does not occur. Check the injection site after the waiting period and observe for induration and redness. If the patient experiences such a reaction, notify the physician immediately. Complete the procedure by charting your inspection of the injection site in the patient's record.